Hi, and welcome to today's episode of Operationally Speaking. I'm here today with Kyle Phillips from Sightpath Medical. Welcome, Kyle. Could you take a few minutes to introduce yourself and tell us about who you work for and where you're from?
Thanks for the introduction, Tina. Yeah, like you said, I'm Kyle from Sightpath Medical. I've been with the company for about 9 years now, and I oversee our marketing, and I'm also the sales development manager. So thanks for having me.
Yes, welcome. Thank you so much for being here. I know Sightpath Medical has been around for a long time, but could you tell the listeners a bit about Sightpath Medical and what you bring to your client?
Yeah, definitely. So Sightpath is the largest national provider for mobile cataract and refractive surgery. We've been around since 1991, so almost 35 years now. Support over 800 surgeons and 1,300 facilities nationwide. And we are creeping up on 3 million eyes served, which should be by the end of this month accomplished, where we've improved 3 million eyes for our patients.
Wow,
Could
that's
you tell a little bit
impressive.
more about custom surgical partners and your background?
Oh, yeah, absolutely. So, for any listeners that aren't aware, we've been in the ASC and office-based industry for the last 21 years. We began doing ophthalmology office-based suites about 20 years ago. And
Hmm.
we've worked over these years to hone our system. And so we've really thought that it would be great to tell our listeners what SightPath and Custom Surgical are doing together to help make developing office-based surgery suites in physician practices easier.
I wanted to say, yeah, we're really excited about the opportunity to kind of combine the expertise of our services. You know, your company breaks down a lot of barriers to getting an office-based cataract surgery, and with SightPath help, we can help with some of the uh, high cost and capital investment. So, can you tell us about how the process works with custom surgical partners and what that looks like for a new surgeon looking to go into office-based cataract surgery?
Oh, yes. Thank you, Kyle. Absolutely. So, how we typically go through the process would we would go to the physician's site, kind of take a look at the space, understand what the amount of space is that they want to dedicate to the office space suite. We've done it multiple ways where they say, okay, I only have this room and maybe these two other adjacent rooms. How can we make it happen? So,
Hmm.
we really take forward their mission and vision with what they have to work with. And we've been able to really accomplish some really nice surgical suites in small amounts of space, but really keeping in mind infection control and patient safety. So we believe we have it down to a science. So we'll do the full feasibility plan for them.
Hmm.
We'll come up with a design for them. And then we will certainly look at equipment. And I think that that's where, partnering with SightPath, you guys have a lot of really great solutions for ophthalmologists trying to get into this space. Why don't you tell us a little bit about what you do as well?
Yeah, definitely. I think the biggest thing that SightPath can help to provide to surgeons moving to office-based cataract surgery is removing some of that capital expenditure. So when you're purchasing a phaco, when you're purchasing a scope, instrument sets, you have to have a lens consignment, surgical pack. There's a lot that goes into it, and that cost can range between 200 to $700,000. You know, if you're using laser-assisted cataract surgery. On top of that, when you own that equipment, there's an ongoing maintenance cost. So your phaco, your scope, your femtosecond laser, those costs are 20 to $80,000 per year, and that's a big capital cost and ongoing cost for surgeons. So something that we're able to do with our model is it's more of a pay per procedure. So every single procedure, you pay us, and then you collect from insurance, and you're profiting on every single case, and you're mitigating some of that ownership hassle and some of the risk. Additionally, with our mobile service, we also provide a certified scrub technician. So these scrub technicians, all they do is eyes every single day. So they're doing, 8 to 10, up to 20 to 30 cases a day with our surgeons. So if we're coming in for one day of surgery, you're getting somebody who knows what instruments you're using, what lenses you're using, your cadence during surgery, so that you really have that expertise when you're doing an office cataract surgery. Um, on top of that, we also have a support team, which is our clinical advisory team. So if there's any questions that come up, for refractive surgery, for cataract surgery. We want to be there to support you. So we have Dr. Downer and Dr. Hardin and Dr. Odrich, who are some pretty well-known ophthalmologists nationwide that you can actually send questions to help support some of that service.
That's really amazing because I do know that, a considerable barrier to developing your office-based suite in your practice like that are the initial outlay of capital costs,
Mhm.
quickly followed by staffing. Well, who's going to assist me in these cases and so forth. So I think that is, definitely important. One thing that Custom Surgical does is we also provide ongoing support. So not only do we help you get from the concept of design and feasibility, but we help you get to those first cases. So we pull it all together for you. And we've been doing it long enough to know that, your practice administrator is wearing five different hats, and the last thing they need to do is, try to run a miniature ambulatory surgery center within their facility. So we've devised a system and we utilize software that make keeping up with the regulations and accreditation uh, easy. And that's another component that, once you're up and doing cases and accredited, it doesn't just stop there. You need to maintain those standards. And so, this collaboration, I feel, really gives a full circle solution to ophthalmologists who are out there, wanting to get into this, but feel that it's, maybe a bridge too far or the costs are too high in doing so. So I really think that, partnering like this, as a team for those who are interested in these aspects of everything, it's a win-win. And
Yeah, and something I love about the service that you guys bring too is when a surgeon's bringing office-based cataract surgery, obviously into their office, there's that, okay, what do I do now? What if something goes wrong? And the support that your company brings takes away some of that stress and anxiety, and it allows that surgeon to feel comfortable knowing they have support. They're not flying on their own. They're not piloting the plane without a co-pilot per se. So it's nice to have that support. Something else that you mentioned is, you kind of you get those rooms up to standard, and there's different procedures that can be done in those rooms. So with Sightpath service, you can be doing cataract surgery one day, laser assisted cataract surgery one day. And then, that Friday, that same week, we can bring in a refractive suite to do LASIK.
Oh, yeah.
So you save all that space. You're not having equipment to sit around doing nothing, and you're having access to that technology that the surgeons are looking for.
Right, right. And one thing that you mentioned earlier about, collecting from insurance. I mean,
Mhm,
certainly all of these strategies are 100% win-win for self-pay cases. So your ICLs, your refractive lens exchanges, things of
mhm,
that nature, LASIK. But we also have that insurance component. So we have billing teams spread out regionally, and then we also work with a national company who will help you get that, partnering with your payer already to garner that secondary fee. So depending on where you are, what region, we'll go after all of those insurers to see, hey, will they garner you that secondary fee? So the supplies that you're putting on those tables, extra fees that you're paying to do those cases within your office-based suite, you'll get some additional monies to help cover those costs as well. So it's definitely a win-win for keeping that revenue in-house, keeping yourself, for the ophthalmologist that is, to be able to manage their own schedule, but then also manage their own patients. Though those patients are familiar with your current team, they're used to coming to your practice for their eye care. And now,
mhm.
full circle, they don't have to go to a separate facility to have procedures done. They're going to be with the same team of people and as the ophthalmologist that they're used to. So it's really a win-win, for that.
Yeah, and I think that's a really great point of, if you're doing surgery at a hospital or an ASC, typically ophthalmology gets the shorter end of the stick schedule wise.
Of course.
And you have rotating scrub techs, you have different anesthesiologists, and the benefit of, your service bringing different anesthesia options in, and the benefit of Sightbath bringing in a consistent scrub tech who only knows eyes. They're not doing ortho, they're not doing spine surgery. There's a lot of different
Right.
specialties out there, and our scrub techs really focused on that one specialty.
Yeah, that's awesome. And that really brings comfort to the ophthalmologist. We've opened, so many office-based suites, but also so many ASCs over the last few decades. And there is, you have well experienced ophthalmologists, but when they sit down in their own center or their
Mhm.
own office space for the first time, it's not the same team that they've been used to at the
Nope.
ASC down the street. Everything is on their shoulders. So really having all of the systems in place helps them get comfortable right quick and really enjoy being able to do it right from the comfort of their own practice.
Yeah, and the surgeon's OR should feel like home, right? So every OR should feel the same. And when you bring it into your facility, that's another really good thing to touch on is every surgeon has their own preferences. So they have their own IOL, they have their own pack, they use different visco. And the customizability that we bring to the table is we're giving these surgeons exactly what they need for surgery. It's not a, hey, come use this lens or this instrument. It's a, what lens do you want to provide to your patient? What instruments do you use that make you the best surgeon possible? We want to provide that for you. And I think accessing that and having that home in the surgery center really makes surgeons, it brings out the best in the surgeon.
Absolutely. And I think too that the patients feel that. So you can walk into a doctor's office and know whether, hey, they're really busy or hurried or not, feeling relaxed. And when you have that control over your patient's experience, they're really going to feel it too. They're going to get the sense of, hey, this is a friendly atmosphere. The
Mhm.
doc is happy, I'm happy, and then they're more relaxed and they don't need that higher level of anesthesia and things like that. So from that perspective, it brings another level of comfort and safety to the patient as well. And, part of what you bring to the table with having a tech that is, an expert in ophthalmology really
Mhm.
helps allay the surgeon's, fear of anything. So I think that that's good.
Yeah,
Uh,
we've all seen the anxious patients before. It always makes the
yes.
day a little bit more worrisome,
Yeah,
making sure everything goes well with them. So,
absolutely.
uh, Tina, at ASCRS this year, I know that you and Sightpath are both going to be present at it. Um, we wanted to make a collaborative effort to be able to meet with anybody who wanted to learn more about this solution with custom surgical partners and Sightpath Medical. Can you go into where you guys are located, booth number, and the best way to get in contact with you to set up a meeting time?
Oh, yeah, absolutely. So we're excited. We'll be at ASCRS for booth number 1259. And, aside from stopping by the booth, you can visit our website, customsurgicalpartners.com, fill out a contact us, request a meeting. I will be on site. So will some of our colleagues, and we will be working with SightPath as well. So we would be happy to meet you there or talk to you even ahead of ASCRS. Feel free to reach out anytime. Where are you guys going to be located, Kyle?
The opposite side from you.
Of course.
So we're booth 2832. So we're in the corner by the concessions. I made sure to be close to the food. So we can
Smart.
meet at one of our booths if anybody wants to have a conversation with us both at the same time. If you wanted to fill out a time to meet with SightPath directly, you can go to sightpathmedical.com. In the upper right hand of the corner, there's a button, just the contact us sheet. Send an email, it goes directly to me, and I can reach out to you to set up a meeting time during ASCRS.
Okay, awesome. Well, we're looking forward to it and looking forward to, bringing ophthalmology to bringing ophthalmology office space suites, to an easy solution for ophthalmologists out there interested in doing so. So thank you so much, Kyle, for joining Operationally Speaking and talking with me today. And we'll see everyone at ASCRS.
Thanks for having me. I'm excited to get this going and see everybody at ASCRS as well.
All right. Thank you.